Dear student, Assalamu alaikum. Today's our topic is drug for peptic ulcer. Peptic ulcer, common disease. Peoples of our country takes this group of drug randomly as OTC drug. What is peptic ulcer? A benign lesion of gastric or duodenal mucosa occurring at a site where the mucosa is exposed to acid and pepsin. It results due to imbalance between the aggressive factors, that is acid, pepsin, bile and H. pylori, and the defensive factors, gastric, mucosa, bicarbonate, prostaglandin, that is excess acid production and intrinsic defect in the mucosal defense barrier. So, why there is peptic ulcer? We are showing imbalance primarily between aggressive factors and the defensive factors. Aggressive factors are acid, pepsin, bile, H. pylori. Defensive factor is mucus, bicarbonate, prostaglandin and nitric oxide. Regulation of gastric acid secretion. In gastric ulcer, generally acid secretion is normal. In duodenal ulcer, usually acid secretion is high. Gastric ulcer and duodenal ulcer combinedly we call peptic ulcer. Proton pump, hydrogen potassium ATPase secrete hydrogen ions which can be activated by histamine, acetylcholine, gastrin. Hydrogen potassium ATPase, that is proton pump, is the final transport pathway for parietal cell hydrogen ion secretion. Hydrogen potassium ATPase is located in the apical membrane of the axanthic cell along the secretory canaliculi. The pump requires large amount of energy that is supplied by intracellular ATP. Inhibition of hydrogen potassium ATPase block both basal and stimulated acid secretion. Classification of drugs used in peptic ulcer. Drugs that inhibit gastric acid secretion, drugs that neutralize gastric acid, usually antacid, ulcer protective mucoprotectors, and anti-H. pylori drug, that is when peptic ulcer associated with Helicobacter pylori infection. Classification of drug used for peptic ulcer disease. Drug that inhibit acid secretion, H2 receptor blocker. Drugs are cimetidine, ranitidine, nizatidine, famotidine, roxetidine. Proton pump inhibitors, PPI, omeprazole, esomeprazole, rabeprazole, lansoprazole, pantoprazole. Anticholinergic drugs, pyranzapine, hyoscine and butyl bromide, prostaglandin analog, misoprostol. Drugs that neutralize gastric acid, that is acid neutralizer, systemic and non-systemic antacid. Systemic antacid is sodium bicarbonate, sodium citrate. Non-systemic antacid is magnesium hydroxide, magnesium trisilicate, aluminum hydroxide, megaldrate. Ulcer protective, sucralfate, colloidal bismuth sulfate. Here misoprostol also ulcer protective. It is a mucoprotector and also inhibit the hydrochloric acid secretion. Anti-H. pylori drugs, amoxicillin, clarithromycin, metronidazole, tetracycline. 2 antibiotics and proton pump used as a triple therapy. Important H2 blocker, that is H2 antagonist, cimetidine, ranitidine, nizatidine, roxetidine. These are the H2 blockers. H2 blockers bind to histamine 2 receptor. Dear student, histamine main receptor histamine 1 and histamine 2 clinically important. Histamine H1 blocker conventionally called antihistamine, and histamine 2 receptor blocker is anti-ulcerant drug. H2 receptor blockers bind to the H2 receptor, preventing histamine from binding to these receptors. Block the action of histamine on stomach cell, thus reducing stomach acid. Indication of H2 blockers: peptic ulcer disease, gastroesophageal reflux disease GERD, erosive esophagitis, Zollinger-Ellison syndrome. H2 blocker also used pre-anesthetic medication along with NSAIDs and corticosteroid drug to minimize adverse effect. NSAIDs and corticosteroid break down the prostaglandin, so it causes gastric ulcer. So prevent the gastric ulcer, we use H2 blocker along with this drug. Cimetidine, now it is not used because of its adverse effect. It causes gynecomastia, galactorrhea. Ranitidine compared to cimetidine, ranitidine is longer acting and is 5 to 10 fold more potent. Famotidine is 20 times more potent than ranitidine. They are metabolized by liver, but nizatidine is eliminated principally by kidney. Proton pump inhibitors. Most effective drugs of PUD, product requiring activation in acid environment. Activated forms binds irreversibly to hydrogen potassium ATPase and inhibit it. You know the drug: omeprazole, pantoprazole, lansoprazole and esomeprazole. Omeprazole is the first drug of this class. It binds to a hydrogen potassium ATPase enzyme system of the parietal cell, thereby suppressing secretion of hydrogen ions into the gastric lumen. The proton pump is the final step in the secretion of gastric acid. Action of proton pump inhibitors. These agents are prodrug with an acid-resistant enteric coating to protect them from premature degradation by gastric acid. The coating is removed in the alkaline duodenum and the prodrug is weak base is absorbed and transported to the parietal cell canaliculus. Omeprazole in itself is not the active inhibitor of hydrogen potassium ATPase. It needs transformation in acid media to an intermediate compound, a sulfinamide, that effectively inhibits the hydrogen potassium ATPase. The sulfinamide interacts covalently with the sulfhydryl groups of cysteine residues in the extracellular domain of the hydrogen potassium ATPase, thereby inhibiting its activity. Indication of proton pump inhibitors. Peptic ulcer eradication of Helicobacter pylori together with 2 antibiotics, aniseed-induced peptic ulcer, gastroesophageal reflux disease ulcer, Zollinger-Ellison syndrome, adverse effect of proton pump inhibitors, nausea, loose stool, headache, abdominal pain, constipation, gastritis, atrophies of the gastric cell, muscle and joint pain, dizziness, rashes. Rare side effect is gynecomastia, erectile dysfunction, leukopenia, hepatic dysfunction, osteoporosis in elderly on prolonged use. Drug interaction. Omeprazole inhibits the metabolism of warfarin, phenytoin, diazepam and cyclosporin. However, drug interactions are not a problem with the other PPIs. Antacid. Systemic antacids, that is sodium bicarbonate, potent neutralizing capacity and acts instantly. Disadvantage of systemic antacid is systemic alkalosis, thereby cause distension of abdomen, discomfort and belching, rebound acidity, sodium overload. Non-systemic antacids, duration of action 30 minutes when taken in empty stomach and 2 hours when taken after meal. Adverse effects, aluminum antacid causes constipation because as they relax gastric smooth muscle and delay gastric emptying. Magnesium antacids, it causes diarrhea. Prostaglandin analog, misoprostol, that is mucoprotector, inhibit gastric acid secretion, enhance local production of mucus or bicarbonate, help to maintain mucosal blood flow. Therapeutic use of misoprostol, prevention of aniseed-induced mucosal injury. Misoprostol doses 200 microgram 4 times day. Adverse effect of misoprostol, diarrhea and abdominal cramps, uterine bleeding, abortion. Contraindication of misoprostol, inflammatory bowel disease and pregnancy, because in pregnancy there may be cause abortion. Triple therapy given when peptic ulcer is associated with H. pylori infection. Almost all peptic ulcer is associated with H. pylori infection, thereby recurrent ulcer develops. The best among all the triple therapy regimen is omeprazole or lansoprazole. Omeprazole 20 mg, lansoprazole 30 mg twice daily, clarithromycin 500 mg twice daily, amoxicillin 1 gram twice daily, given for 14 days, followed by PPI 4 to 6 weeks. Short regimen 7 to 10 days. Who are they? They are Nobel laureates of medicine in 2005. The discovery of H. pylori and its role in peptic ulcer, Barry J. Marshall and J. Robin Warren. Thank you all, dear student, for your patience hearing. Allah Hafiz.